In this section, Toxicology 2, we'll discuss some more side effects of medications, as well as hypersensitivity reactions, and which drugs are safe and unsafe in pregnancy. In this section, Toxicology 2, we'll talk about some more drug reactions, and as well as specific cutaneous reactions to certain medications. Another common medication that has specific side effects is isoniazid, which is an anti-tuberculosis medication. It can cause hepatotoxicity and peripheral neuropathy. The peripheral neuropathy can actually be prevented by giving the patient vitamin B6. Most patients that are on INH therapy for TB should be on vitamin B6 for prevention. Opiate overdose is very common. Patients that take opiates for chronic pain or for sickle cell disease will present usually with respiratory depression, meaning they're breathing at like 4 times per minute or 5 times per minute, and they will have meiosis except for patients that have chosen to overdose on meperidine, which usually does not cause meiosis. The antagonist for opiate overdose is naloxone. And we usually will give this medication in the emergency room if a patient comes in and they're unconscious, and we don't know what happened to them. So it's a very safe medication, and what it does is it blocks the ability of the opiate to bind to the receptor, and it usually wakes the patient up very quickly. So know that naloxone is the antagonist in the cure for opiate overdose. Organophosphates we've already talked about pretty extensively. They are actually acetylcholinesterase inhibitors. They include insecticides and nerve gases. Remember the signs of organophosphate poisoning for the test, including meiosis, vomiting, diarrhea, bradycardia, basically acetylcholine overdose. And know that the treatment for organophosphate poisoning includes supportive care, including knowing your ABCs, airway, breathing, and circulation, and support that as well. If you need to intubate the patient, you go ahead and do that. And then the 2 medications we commonly give are atropine and pralidoxime, which are able to both block the muscarinic effects and prevent inhibition of the acetylcholinesterase molecule. Usually the 2-PAM has to be given early to be effective. Cutaneous drug reactions, these are very important to understand. They're usually tested pretty heavily in the USMLE because they're usually avoidable. These drug reactions can occur under certain unique circumstances, or they can be part of a larger picture, an idiosyncratic picture such as Stevens-Johnson syndrome. Remember that cutaneous drug reactions will range in severity. Some reactions to drugs will just be a rash. And some reactions will be life-threatening and will involve necrolysis or the Stevens-Johnson syndrome. It's important to know which drugs are most often implicated in very severe reactions, and to understand that patients should be aware of the side effects of these medications. The anticonvulsants are classic for causing severe skin reactions, especially dilantin or phenytoin and lamotrigine. Lamotrigine has the most frequent rate among anticonvulsants for causing severe cutaneous reactions. Also, antibiotics such as sulfa drugs, penicillins, and cephalosporins can cause severe skin reactions. Erythema multiforme is a very benign skin condition. It's mentioned here because it's thought to be a possible precursor to more serious skin conditions. It's composed of itchy erythematous blotches that are symmetrical. Usually if it's on the right side, it'll also be on the left side. And they usually start in the extremities, in the hands and the feet. The classic board catchphrase is target lesions. So if you see target lesions in a patient, think erythema multiforme. You should also think about Lyme disease in that situation. The most common cause for patients to have EM or erythema multiforme is for patients that have some type of herpes simplex infection. It's related to mycoplasma infections as well, and many medications. Usually it's a benign condition and it goes away all by itself. Here's an example of erythema multiforme. You can see the target lesions here on the skin, on the extremities. They're erythematous and forming blisters, and they're usually very pruritic or itchy. Moving on to Stevens-Johnson syndrome. Stevens-Johnson syndrome is a very serious condition. Usually it involves a viral-like prodrome, including nausea, fever, and and it can progress to facial swelling and tongue swelling. It then produces hives, skin pain, and skin blistering. Classically, it's thought to involve less than 30% of the skin's surface. Stevens-Johnson can present many different ways. This patient appears on the back to have multiple hyperpigmented patches. Toxic epidermal necrolysis is a very, very serious skin condition that can cause full thickness necrosis of the skin. You can see this patient has severe skin necrosis. The treatment for cutaneous drug reactions is always to stop the medications that are most likely causing the skin condition. Some severe cases of cutaneous drug reactions will require intensive care. IVIG, or intravenous immune globulins, have been shown to improve outcomes in patients that have these severe drug reactions. Some patients will also require intubation and skin grafting. Let's talk for a moment about the different types of hypersensitivity reactions. It's possible that on the test, you'll be tested in your ability to remember which type of hypersensitivity reaction is which. For type 1 hypersensitivity reaction, this is usually an immediate hypersensitivity reaction. It's also known as anaphylaxis. The most common examples of type 1 hypersensitivity are the penicillin anaphylactic reaction, an allergy to penicillin, and angioedema, which is caused by angiotensin-converting enzyme inhibitors, or ACE inhibitors, and this is usually mediated through the IgE pathway. Type 2 hypersensitivity reactions are generally considered cytolytic reactions, and this is involved in IgG or IgM causing complement to fix onto host cells and cause lysis of those cells. An example of this is clozapine, the atypical antipsychotic causing agranulocytosis. This medication, clozapine, causes our body to attack itself, specifically in the bone marrow. This is why patients taking clozapine should have complete blood counts weekly. Another example is hemolytic anemia with the blood pressure medication alpha-methyl-dopa. Type 3 hypersensitivity reaction are antibody-antigen complex deposition diseases. In type 3 hypersensitivity, an antibody complex which binds to complement is able to deposit in the vasculature. Some examples of this include serum sickness that usually is brought about by some type of drug, as well as introducing some foreign serum into the body, usually some type of therapy, such as an antibody therapy. This is described by urticarial skin eruptions, arthralgias, arthritis, and lymphadenopathy and fever. Drug-induced lupus or erythematosus is an example of type 3 hypersensitivity, as well as certain vasculitides or vasculitis. And it's thought that Stevens-Johnson and toxic epidermal necrolysis are type 3 hypersensitivity reactions. Here's a picture of drug-induced vasculitis caused by phenytoin. You can see the patches on this patient with blistering here. And these would be non-blanching, meaning you could push on these and they would not turn white, meaning that there's actual blood clots in these areas. And this is serum sickness caused by penicillin. And you can see that this patient has sort of a stocking glove distribution of deposition of immune deposits in the foot and the hand. You can see right here as well. Type 4 hypersensitivity reaction is also known as delayed hypersensitivity, and the classic example is contact dermatitis from poison ivy or neomycin. This is carried out through T-cell mediated skin reactions. Let's talk for a second about drugs that are unsafe in pregnancy. Remember that drugs taken by the mother can harm the fetus, and these would be called teratogens. Many medications can cause a risk of congenital anomalies, especially ethanol, thalidomide, and warfarin are the classics. They can damage fetal organs. For example, radioactive iodine has been known to destroy the fetal thyroid gland. And opiates taken during pregnancy can cause physiologic effects on the fetus, causing hypoxia, for example, in the case of opiates. This is a diagram that shows as the fetus ages, to the right, there are certain times during which the fetus is more or less susceptible to developing developmental problems. During the first 2 weeks, it's thought that the fetus is pretty much not susceptible to teratogens. However, during weeks 3 to 8, the fetus is highly sensitive to teratogens. And you can see the different systems here. Every system seems to be very sensitive. The ears, the genitalia, the teeth, the legs, arms, the heart, the central nervous system in the first trimester from 3 to 8. In the later part of the pregnancy, the baby does not appear to be as sensitive to teratogens. And this just shows a pie chart that shows that after conception, the classic teratogen period is up to 71 days. Thalidomide is a medication that you should know for the boards. It's very uncommonly given today. This is a classic example of a teratogen, and it was used back in the 60s much more commonly than it is now. It's not teratogenic in most animals other than humans. It was originally used for the treatment of nausea and vomiting during pregnancy. However, it was shown that the babies that were born from mothers that were using thalidomide would develop severe limb anomalies known as phocomelia if they were taken at the critical period during pregnancy. Therefore, it was removed from the market for nausea and vomiting. However, thalidomide is still used for certain medication for certain diseases such as multiple myeloma and leprosy. It cannot be used by pregnant women. Retinoids are other medications that should not be used during pregnancy. Vitamin A derivatives, and they are used for treatment of autoimmune disorders such as psoriasis and acne. They are known to interfere with fetal development if taken at the critical period as well. And instead of using this for acne, women should use topical benzoyl peroxide or erythromycin. The classic congenital abnormalities due to isotretinoin exposure or retinoid exposure during pregnancy shows a baby with missing earlobes, facial dysmorphism, and mental retardation. Other medications that are unsafe during pregnancy include androgenic drugs. For example, danazol. They can cause fetal masculinization. And DES, or diethylstilbestrol, is a medication not used anymore. However, back in the 60s and 70s, it was used commonly, and babies that were born from women that were taking this medication, which is a earlier form of birth control, those babies developed clear cell adenocarcinoma of the vagina, which is otherwise a very rare tumor. Other medications that are unsafe during pregnancy include thyroid medications such as radioactive iodine, which can destroy the fetal thyroid gland. It's safe to use PTU or methimazole instead if the mother develops hyperthyroidism. It's also not good to use plain iodide, ion, in the pregnant woman because that can cause the baby to develop neonatal goiter. This is an example of neonatal goiter in a baby whose mother took iodide ion during pregnancy. Other medications that are unsafe during pregnancy include carbamazepine, which has been shown to cause neural tube defects, phenytoin, which causes the classic fetal Haydn-Toyn syndrome, which is characterized by growth retardation and central nervous system abnormalities. Also, valproic acid can cause neural tube defects. In general, it's thought that a pregnant woman that has epilepsy or a seizure disorder should weigh the risks and benefits of becoming pregnant. And then medication regimens, whatever medication they have to be taking, should be tailored to keep the plasma levels of the drug as low as possible to prevent seizures. In general, no anticonvulsants are considered safe during pregnancy. However, if they must be given, they must. Each case is taken differently. One medication that should not be used during pregnancy is lithium. Lithium has been shown to cause Epstein abnormality of the heart in the fetus, which is basically an abnormality of the tricuspid valve. The tricuspid valve becomes displaced towards the apex of the heart, and it can also cause septal defects in the atrium. Other drugs that are unsafe during pregnancy include chemotherapy medications such as cyclophosphamide. Cyclophosphamide can cause central nervous system malformations and other cancers in the fetus. Methotrexate can cause central nervous system malformation, limb abnormalities. Methotrexate is actually used as medical therapy for ectopic pregnancies. We'll talk more about methotrexate and cyclophosphamide in later lectures. Cocaine can raise the blood pressure in the mother, and by raising blood pressure can cause placental abruption and fetal growth retardation. And opioids can cause neonatal withdrawal syndrome and respiratory depression in the neonate as well as in the fetus. Ethanol during pregnancy, as you know, can cause fetal alcohol syndrome. And fetal alcohol syndrome is classic for causing growth deficits, central nervous system deficits, including microcephaly and mental retardation, as well as craniofacial abnormalities, which are classically known as the thin upper lip and the smooth philtrum. The philtrum is the area right above the upper lip. Other medications that should not be given during pregnancy include ACE inhibitors and ARBs, or angiotensin blockers. These are considered to be teratogenic and are not safe because they can interfere with fetal renal function and cause oligohydramnios. Oligohydramnios, as you know, can cause fetal injury because there is not enough amniotic fluid in the cavity, and then the fetus is able to become injured because of that. Patients that need antihypertensives during pregnancy can take alpha-methyl-dopa and hydralazine, which are considered safe in pregnancy. Other medications that should not be used in pregnancy include warfarin, which can cause classic skeletal defects and central nervous system anomalies. Heparin is considered to be safe during pregnancy. It's a very large charged molecule that does not cross the placenta. Other medications that should not be used include tetracycline, which can cause yellow discoloration of the teeth and can cause growth abnormalities because it deposits in teeth and bone. And indomethacin can constrict the fetal ductus arteriosus, so it should not be used during pregnancy. The FDA has a classification of medications in terms of their safety during pregnancy, category A through category X. Category A are known to be safe, and usually medications that fall in this category are simply vitamins. Category B are probably safe medications, such as penicillin and erythromycin. Category C should be used carefully if the benefit of using it outweighs the risk. These include medications such as fluoxetine and amitriptyline. Category D are medications that are known to cause problems for fetuses, but if the mother needs to take them to stay alive, then they should be taken. And these include medications such as lithium, phenobarb, dilantin, phenytoin, amiodarone. Category X should absolutely not be used during pregnancy. And that includes methotrexate, thalidomide, and warfarin. Some medications are classically contraindicated while the mother is breastfeeding their child, and that includes tetracyclines, amiodarone, radiopharmaceuticals such as radioactive iodine, and anti-neoplastic agents. This concludes Toxicology 2. Next, we'll discuss some questions having to do with toxicology of medications.